It's amazing because even in the Bible, in Leviticus, it talks about how mold exposure causes diseases and skin diseases. And it gives you clear instructions. It gives you
Interesting.
clear instructions on how to remediate mold, which is basically the way it is today. But it
Wow.
basically says that they would have
Yeah.
someone come out like a priest to assess it and actually see if it is mold. Then if it is mold, you take out that stone, you take it like a mile from the town, and then if it comes back in the house, you're supposed to destroy the home. That's what the Bible says.
Wow, because sometimes sometimes there's things you can't even see. It could be in layers behind. You may not be able to see it on the surface, right? And by the time you see it on the surface, it's how much is behind the walls, right?
Welcome back to the Holistic Health and Hormones podcast, where we explore the root causes of health challenges and share holistic solutions to help you restore balance and hormones in your body. Have you ever felt like there's something just not right with your health, yet every test comes back as being normal? Many people today are struggling with symptoms like their digestive issues, fatigue, brain fog, anxiety, and chronic inflammation without clear answers. And in many cases, these so-called mystery illnesses may actually be connected to deeper issues in the body, primarily the gut, the immune system, and other environmental exposures. In today's episode, we'll explore the connection between gut health and chronic inflammation, unexplained symptoms, and how addressing the root cause can help people reclaim their health and hormones again. Let's dive in.
Welcome to the Holistic Health and Hormones podcast. Today, I'm super excited to have Gabriel Smith, who is a certified functional nutrition practitioner. He's a gut health specialist and a personal trainer. He has a passion for helping clients with unresolved digestive issues, unexplained symptoms such as mystery illness, anxiety, depression, food sensitivities, and vector-borne illnesses. His desire to overcome his own health challenge through holistic methods is what drives his passion. He's dealt with severe digestive issues, anxiety, depression, chronic fatigue, long COVID, mold, and rare condition called alpha-gal syndrome. And now he helps clients in the States rebuild their health and live life to the fullest, what he calls his 4 pillars of health, paired with step-by-step processes to remove toxins and pathogens from the body. When he's not working with clients, he enjoys playing piano for his church, getting out there in nature, and spending time with his wife, who is now currently pregnant with their first child. Welcome, Gabriel.
Thanks for having me, Ellie. I really appreciate you having me on the podcast, and I'm excited for this conversation.
Yeah, look, I'm excited to hear, you've gone through a fair bit and that's why you really, tapped into functional medicine, natural health. I'd love to just hear a whole background into sort of how all of this started, how you came across working and healing yourself naturally. Yeah, I'd love to hear your backstory.
Yeah, definitely. So my health journey started really when I was 15 is when I first got into fitness. And I wanted to be a personal trainer. I was pursuing Men's Physique show. And my health decline really started around the age of 17. I was pushing my body really hard, and which everyone knew me as, like, my friends and family knew me as, like the healthy fitness guy, right? But on the inside, I was kind of breaking down. I was really pushing myself, especially as I was going into adulthood. I was working a full-time job, but still trying to, hit the gym 2 hours a day, 6-7 days a week. And I didn't allow myself that time to recover. And this is around the time when I started getting some digestive issues, which there was something else going on at the same time, which I'll touch on in a second. But I started this down spiral with like bloating and food sensitivities. And I started getting more like joint pain and some neurological symptoms as well. Like I was noticing some mood symptoms that didn't quite seem like myself, some brain fog. And that is what started the process of me diving into alternative medicine, because I think like a lot of people that experience some of these things, you go to the doctor, they look at your labs and say like, oh, you look normal, right? You're good. And, but obviously I was feeling like I was dying. So I started looking at some different alternative solutions to heal. And as I was going through this journey, I kept feeling like I hit like another roadblock, like things would get worse. Like in 2021, I was having, all this joint pain. I ended up tearing my shoulders. So I tore both my shoulders just from that like chronic inflammation.
Wow.
And yeah, so then I had to go through surgery, which I had terrible reaction to the MRI dye. Like 3 days of like nausea and vomiting. And I had no idea why it caused that because couldn't find much info online about the MRI dye causing that type of issue. But there was that. I had issues with medications, started reacting to like bee stings and things I never had problems with before.
Wow.
And I was like, okay, something is like seriously going on here. And then I even experienced
Yeah.
what, looking back, I know now, it was an anaphylactic reaction where I actually blacked out and stopped being able to breathe. And I was like, okay, like something's got to change. And at one point throughout that journey, I was even bedridden with like COVID for a month, which I'd gotten COVID before and it was fine. So something was going on. And I finally got the diagnosis for alpha-gal syndrome after 5 years of trying to get answers. And this came from when I was 17. I had a part-time internship as a land surveyor. So alpha-gal syndrome came from a tick bite while I was doing the land surveying, right? And that's what kind of triggered that
Wow.
whole downward spiral to end up in the place I
Just a
was.
tick bite. You just think a tick is nothing, right? But to get something so severe after a tick bite.
Yeah, exactly. And there was a lot of times there's multiple things going on. There's Lyme as well. And
Yeah.
it ended up when I was at my lowest point, I was working in a moldy building as well. I was being exposed to toxic mold. And that's really what just
Yeah.
did me in. I already had the
Yeah.
digestive issues. My immune system wasn't working properly, right? And then I got hit with the mold.
Yeah.
And that's when I was just like,
Yeah.
I went down to like a 10% in my health. And I was like, I truly thought I was going to die. I was like, this is it. This is the end for me. It's brutal.
And you think, right, many people out there who have chronic illness and like I said, could be chasing answers for years. And like you said, you've been looking at it for many years before you actually got the answer.
Mhm.
And what is the biggest turning point that helped you finally understand what is happening? You're like, enough is enough. I'm not going to give up. Even though a lot of the Western medical doctors, right, and it's
Yeah.
the same here in Australia and a lot of the places that practice Western medicine, it's like they're not willing. Did the labs come back normal? But you're like, it's not normal. There's something else going on. And doctors, as far as sometimes will say to them, it's all in your head.
Exactly.
No, there's nothing wrong. You'll get better. Like how frustrating when they think that these symptoms are clearly in your head when you are feeling it physically, you can't function.
100%.
It is not normal.
100%. Yeah, I would say so. The
Yeah.
biggest turning
So, like,
point for me was really discovering the idea that the body is a holistic system, right? And you can't just isolate one part of the body and expect to heal. You have to consider everything. And I was best to explain to it this way. If you think of your health like a tree, right? And all of the symptoms and diagnoses you experience are branches. Those are branches to an underlying root issue, right? And within
That's
our
right.
body, right, the three main roots is genes, digestion, like organs, and then inflammation. And even functional practitioners can fall into the trap of just treating the roots, but they don't ask the next question, which is why are those roots inflamed in the first place, right? Why are those roots sick? And the answer is it's the terrain. It's the terrain those roots grow in, which leads to disease. And understanding that concept alone really just accelerated my healing because, I started looking at other options, right? I started saying, okay, if the testing is showing that it's normal, then I need a different test, right? I started seeking out holistic practitioners, and that's really when I started moving in the right direction.
And that is so important because as a natural health practitioner, I've got a Chinese medicine degree and I
Nice.
do a lot of functional testing.
Beautiful.
And I look at all of it holistically. And it's true, a lot of people, like they come in and they've been to so many different doctors. They've had so many different symptoms that they can't find that one root issue that is a cause of a lot of it. And like I said, a lot of it is people blame their genes, but it's not genes, it's epigenetics,
Yeah.
which we can talk about. Right, genes is one thing, but it's like, what are you doing with your diet, lifestyle?
Exactly. The environment
how is
signals
your
the gene.
stress?
Yeah.
The environment. Like I had a client, like talking on mold, She was being very sick for about 3 years, and she moved into an office that was constantly getting rained upon, and it was
Mm.
very damp. And the lady before her in the same office was extremely sick, and it wasn't until she left that she felt a lot better. And she was very sick, and all the doctor specialists that she had had testing for did not pick up mold at all. And when she described her symptoms, the first thing I said was, "This sounds like mold." And literally, when she went to get someone to come and check for office, it was riddled with black mold. And the doctors were telling her symptoms were normal. She was so fatigued that for half the week she was in bed. That's not normal, right? So a lot of these could be your environment, because if you don't remove yourself from a toxic environment, then that's never going to get better. Or people move into a new place and then the health starts declining. And you're like, what's happened? They can't breathe properly. They're having fatigue, brain fog. So it's really looking at every avenue and you're like a detective, and I'm the same. It's like looking at, okay, what haven't we checked? What haven't we checked for? And making sure we get to every little symptom and answer. So we find, okay, this is what's causing all of these problems, right? And then working on it layer by layer. So, I mean, look, like she had symptoms for many years, and
Uh-huh.
it wasn't until we found out that her whole office was riddled with black mold. And that's why
No.
she was so sick. Yet many of the doctors and specialists just kept saying, they didn't find a root cause. And so now we're working on getting her back into optimal health. But what I was saying is that we have to be like a detective. It's like looking at everything and not leaving any leaf unturned, right? Because it's something that we could be missing. And once you get to the root cause of everything, your body, then you can start healing it
Exactly.
properly.
Once you find where those obstacles are, start removing them, the body starts to naturally repair itself, right? That's awesome. Yeah, and like you said, it's amazing that so many people miss mold. And it's like, you and I, we're big in this world now. Like, a lot of toxicity and diseases, like my mind automatically goes to like, we gotta make sure there's no mold exposure, right? And like, but a lot of people don't even think of that. It's amazing because even in the Bible, in Leviticus, it talks about how mold exposure causes diseases and skin diseases. And it gives you clear instructions. It gives you
Interesting.
clear instructions on how to remediate mold, which is basically the way it is today. But it
Wow.
basically says that they would have
Yeah.
someone come out like a priest to assess it and actually see if it is mold. Then if it is mold, you take out that stone, you take it like a mile from the town, and then if it comes back
Yeah.
in the house, you're supposed to destroy the home. That's what the Bible says.
Wow. Because sometimes I mean, sometimes there's things you can't even see. It could be in layers behind. You may not be able to see it on the surface, right? And if you by the time you see it on the surface, it's how much is behind the walls,
Right.
right?
Exactly. As
So
roots that go deep.
yeah, there's so much. Yeah, yeah, yeah. But that's a lot of we can go into a bit more about mold later if we've got a chance. But yeah, it's a big thing. If people haven't looked at it and they're living in a place that doesn't get much sunlight, or it smells, or it's a bit dampy, anything like that, we're starting to see things on the surface of the walls. It's really important to have that looked at. And like I said, sometimes it is like getting it thoroughly cleaned, or if you're renting, moving out, sometimes you need to remove yourself from the environment that is causing you sickness, whether it is a physical environment, an emotional environment sometimes, right? It's
No,
all of that.
exactly. You can't
So
heal the
being
environment
in that
making you
same
sick,
environment.
right?
Mm. Correct. Yeah, yeah. Let's talk about mystery illness. So what does that actually mean? What do you see in terms of mystery illness, and why do so many people feel unwell, like we mentioned, when their tests are coming back normal? What can they start looking at that they haven't already looked at?
Exactly, exactly. So mystery illness is when someone has like real symptoms, right? But standard labs say that they're normal, right? It says everything's fine when it's obviously not. And so the issue is that most testing looks for disease, not for dysfunction.
Mm.
So people are kind of stuck in this gray area where something is wrong, but it's not bad enough to be labeled, right, by conventional medicine. So I think the key to like uncovering what's going on is having a very thorough like intake assessment from someone that actually knows how to read the body, right? I think that's foundational. People automatically jump to expensive labs, but I think that's like the foundational piece. And then if needed, you can get a lot from the basic labs like a CBC, lipid panel, metabolic
Sure.
panel. And
Yeah.
then, from
Yeah.
there, you
Yeah.
can branch on to more functional labs. Like I really like organic acid testing. And
Yes, I
Yeah.
love acid testing, gut
Yep.
testing.
Yep.
Yes, we need to. I think most people should get their microbiome tested.
Yeah. Yeah. And even then, like, honestly, I don't even use microbiome testing that much in my practice. And I need to dive more into it. But from what I've seen is that people can send, it depends on the test you're using, right? But I've seen people that
Yeah.
have you send out the same stool samples to the same company and gotten completely different results back. Right. So it's like, I'm always hesitant to use some of the tests like the gut zoomer because I feel like there's some foundational ones that are a bit more accurate than some of those. I think there's a place
Mm.
for them, right? But that's kind of where my mind goes.
Yeah.
And I always like to start with something that's less common, but it's called an MVX plus test. I don't know if you're familiar with this one,
Mhm.
but it basically looks at,
It might be called a different name.
hmm,
It might be called a different name or different
yeah.
laboratory, but if you sort of remind me what that test for, I'm sure we have something similar here, but
Oh
it's just a
yeah, yeah,
different name.
true, true. But basically, this measures 6 key markers that kind of look at the terrain, what's going on in your body. I first learned about it through
Mhm.
Dr. Darren Schmidt. He's a chiropractor. He
Mhm.
does detoxification programs, and
Mhm.
that's a really cool test.
Mhm.
I use that as like a foundational testing piece to help kind of get to an underlying cause of
So
what's
similar
going
to,
on.
yeah, there's a company here. Yeah, I think there's a company here which it's kind of like we call it like an OMX,
Mm,
and it's like looking at, okay, is it neurotransmitters? Is it gut health? Is it metabolic?
mm, mm.
Right? Is it, and so it's looking at the sort of 6 key factors of what needs to be prioritized and worked on first in your body before, we can start getting a bit of traction in getting people to feel better, or what is actually the number one thing that needs work. Another test that I kind of like and I think it's important is to actually have a look at your genetics. I find that if people, you need to do it once because based on your genes, you would know, okay, what do I need to change in my diet and lifestyle? This is when people probably don't have a specific chronic mystery illness, but are looking to, how can I prevent illness? How can I optimize my health? Because we could all be sort of plateauing, that we could all, I think more people could be in better optimal health, because if you just stay where you are or you get worse, it's going to be, much harder to get back into baseline or staying in optimal
Yeah,
ranges, right?
definitely. I think the
So
genetic testing is a cool piece. I think it depends on the person, right? I know you knew that because, like, with you and me, I think we're people that we would enjoy seeing the genetic results, right? So, okay, what can we do to help support
that's
this?
right.
And then, of course, there's people that
Yeah.
you're like, they probably shouldn't take a genetic test because it's going to stress them out. I recently started working with a
Yeah.
client who she's working with some conventional practitioners, and they got a bunch of genetic testing done. And she was like, "Oh, I'm susceptible to like this ovarian cancer," and she had her ovaries removed.
Yeah.
Right. It's like a
Wow.
preventative
Yeah.
thing, and I'm
Yeah.
like right, so I think that's where
Yeah.
we have to be
That's not right.
cautious with
Yeah.
those. Right.
Angelina Jolie, who has a BRCA gene and then removed a breast, right?
Right.
It's not that, but like we know, right? Our genes are just one thing, but it's what we do to switch them on and
Exactly.
off. It's the epigenetics that we're working with, diet, lifestyle, emotions, all of that. So
That's
yeah,
beautiful.
it's only one part of the puzzle. But
Definitely.
look, you would be on gut health, and we know how important
Mm,
gut health is. Let's talk about that. And for
uh,
someone new to the topic, I know most people have heard of it, but they probably don't know the intricacies of really that connection between gut health and chronic inflammation in the body.
yeah, definitely. Well, yeah, so I'll start with this. When a child is being formed in the womb, the first bundle of cells that is formed is the nervous system, and it's like the brain and the
Yeah.
spine, right? That
Yeah.
second bundle of cells is called the enteric nervous system, and it's the gut. And it's
Mm,
connected through the
mm.
vagus nerve. So you have these two systems
Yeah.
that communicate back to each
Yeah.
other. They send messages back and forth, and then everything else forms around it. Right. So from the beginning of your existence on Earth, that gut and brain is directly connected. And when that gut becomes inflamed, and this is known as leaky gut, when it becomes hyperpermeable, where you're able to absorb more than just the nutrition you need through that gut lining, when you're able to get partially digested food or bacterial fragments that get into the bloodstream, that's going to contribute to full body inflammation, right? Because your immune system knows those things shouldn't be in the blood, and your immune system goes on to full attack mode to try to keep you safe, right? So you have to seal and heal that gut lining to keep the immune system in check, or else it's just going to spiral into chaos.
And so many people just are not looking after their guts very well. So what are some of the patterns you've seen? We can describe some things that I've sort of seen that has basically led them to severe inflammation in their body, all other sort of chronic illness, all stems from the gut. Because as we know, right, 80 to 90% of all of our immune system is in our
Yeah.
gut.
Yeah, exactly. I mean, like comments to like habits. I mean, I know for one, obviously a big one is the antacid, right? And the low stomach acid piece. So because as we age, just like everything kind of slows down, like you get a little bit weaker, right? You get a little slower.
Okay.
Digestive acid does decrease a little bit, but so we need to do things to keep that up. But the problem with when people have the acid reflux and they're taking antacids to bring that acid down, it's a shame because the reason they have acid reflux is because of that lower esophageal sphincter that's supposed to keep the acid in the stomach and keep right, it opens up to release to let food come through, and then it's supposed to stay sealed shut to keep the acid from coming back up. When you have mineral deficiency or magnesium deficiency, which a lot of people do, that there becomes weakness in that barrier. Now the acid is coming up. So the problem is not too much acid, it's not enough minerals keeping that sphincter shut. Now people take antacids, they lower the acid even further, right? And now that's your body's line of defense from pathogens. So now you're going to get even sicker. So I see like the stomach acid piece, people taking antacids is like, I think probably the most common habit that I see that's like destroying their gut, destroying their health.
Instead of treating the root cause, right? Again,
Right.
that's kind of like a Band-Aid effect, right? Because you need to take something, but you're not treating what is actually at the root cause.
Yeah.
And so even toxins, pathogens, right? All that environmental exposure contributing to a
Oh my
lot of that
gosh.
gut
Yeah.
issue as
Yeah.
well.
100%.
Like how much toxins, like we're talking, like, you can go through some of the things that you see, but we just live in a very
Oh my
toxic
gosh. It's so
world.
toxic. We have like metals dropping from the sky from the plane fumes, right?
Yep,
Got the
yep,
glyphosate
yep.
everywhere.
Crazy water. Yeah. What's the water quality like? Like I know the water in Australia probably very similar. I mean, it's full of
Oh my
fluoride, heavy
gosh.
metals, all sorts of rubbish in the water that we
Yeah,
have.
it's estimated that, I mean, the water content is a big issue with the glyphosate because the glyphosate gets into the water system, right?
Mm,
And,
mm.
it's estimated that about 96% of Americans, if you tested their urine right now, they would have glyphosate in the urine. And they used,
Wow, that causes so
yeah,
much
it's terrible. They
inflammation.
used to
Yeah.
think that glyphosate came out easily, but it actually is very hard to get out of the body, right? It binds to your glycine receptors. It basically binds itself in your collagen and leads to breakdown of tissue and everything. So it's very toxic for the body. And I think it's a big contributor to that toxin bucket that leads to disease.
Yeah. And I think, look, there's one thing people should do is get themselves a really good water filter because we drink a lot of water and our taps and people just thinking boiling water
Yeah.
or a lot of people drinking just tap water. Look, we do live in a fairly good country where you can just do that. But the stuff now, our taps and the water quality is
No,
not what
exactly. And
it
not,
used to be,
not
right?
just
If
for
you
drinking
can get,
water too, like, for your shower, right? Get a filter, a shower head filter.
yeah,
Yeah.
yes. So yeah, correct. I just changed my shower head filter, but we've had a shower head filter now for a couple of years now.
Nice.
Oh my gosh, it's life changing. Like my son used to have very bad
Mm.
eczema, and ever since we've had the water shower filter, like his skin's just
Wow.
improved significantly.
Wow.
But there are lots of things like we don't realize all these little things contribute, and our skin is the biggest organ. So people think, oh, that's just shower
Hmm.
filter, but it is also a very toxic thing as well. Look, it's all the little things, but they all add up, right?
Yeah.
People are like, oh, it's so, overwhelming. But whatever you can do, even cooking utensils, right? A lot of the cooking
Yeah. The cooking ware is
pots and
very
pans are
toxic.
highly toxic. Cookware,
And
yes,
the
yeah.
cleaning solutions people have in their
Cookware,
house,
yes,
candles are very
yep,
toxic. Even the
yes,
EMFs, like, I'm a big believer in
yes,
reducing that the toxic electricity, the
right,
EMF environments, because as we're sitting here
yep.
talking on laptops, right? But yeah, the
Yeah, yeah,
EMFs
look, it's
are
part of
it is.
life though when you can, right? I'm always telling people to turn off their mobile phones at nighttime next to them, turn off their Wi-Fi, not using microwaves and not having the phone next to their ears, all sorts of things. Like anything we can do to minimize the overall exposure, that compounds over time is always gonna
Yeah,
help.
I 100% agree.
So what a lot of that is contributing to a lot of different symptoms. So people might be not feeling well because it might start off with, okay, a bit of anxiety, then depression, then brain fog, and then fatigue. And then they can't function very well. It starts affecting their hormones, like you name it, right? So when is it like, okay, this is time to start looking at getting serious with my health or finding answers, because it just gets worse and worse if people are not really looking at it and they go, oh, it's just a bit of anxiety.
Right.
But it's coming from really systemic underlying
No,
issues.
it is. It is. And neurological issues like stemming from the gut, like I see all the time, right? And it's so sad because a lot of people think that, it is just stress or I just have anxiety. Whenever I would say whenever you see a more chronic version of that, like if you're not anxious about something specific, right? You just notice you have more like consistent anxiety. You need to think like gut health, like what's going on under the surface, right? And the sooner you can dive into that, the better. And I think, there's a lot of things people know they should be doing before they get to that point that a lot of people aren't. But there are, cases like you're talking about with your client with the moldy office. There will be cases where you happen to stumble across something on the earth that's toxic, and it weighs on your health. And
Mm.
yeah, I mean, when it comes to like the question of when should you dive into that further to really heal, as soon as possible. The sooner the better, because the longer you leave something unattended, it's just going to keep getting worse, right? I mean, your health and your gut is like a garden, right? If it's left to itself, it's going to grow a ton of weeds, and you want to pull out those weeds so flowers can grow. And yeah,
The thing is, though, when a lot of the clients, and I've heard in the US, it's quite severe, like they're diagnosing people very young with depression. And the first thing they want to do is give someone antidepressants, right? Or anti-anxiety medication. If you go to a Western doctor, that's the first thing they're going to do. Instead of treating why are you so depressed, which is a lot of the time neurotransmitters, it's, a lot of the food and, a lot of toxins, a whole bunch
yeah, the
of,
gut
or
inflammation,
whatever
everything. Yeah,
the cause of it is. Yeah, that when they go to a doctor, the first thing a doctor wants to prescribe is an antidepressant.
yep,
And then they're on it for
yep.
years and years and years. And before you know it, it's not
Hmm.
working, it's getting worse. So they up the dose,
Well, that's what I was gonna
right? Or they
say.
try a
Like,
different one. And
ask
I've had
someone who's on
clients, yeah,
antidepressant if they're no longer depressed,
yeah,
right? And unfortunately, they don't feel like they're doing much. They still are.
they still are, right? And then usually a lot of time it gets worse. And so they're on very strong. And their doctors, what they do, they just keep upping the
They just keep upping the
antidepressant
dose. Yeah,
dosage.
yeah. It's sick.
Um, so
It's
yeah,
sick. Makes me sad.
definitely need to be looking at, yeah, need to be looking at gut health. Like I've heard that as young as they're doing that in the States, but girls and kids as young as 4 years old are getting antidepressants. Like
Really?
what child is depressed at 4? Like it is
Wow.
insane. Insane.
Oh my gosh.
Yeah. A lot of us started after COVID, but yes, there were doctors and prescribing antidepressants to children very
Yeah,
young.
the thing with children is making me
Mm.
very sad, especially with, Ozempic. They're given to like what 8-year-olds.
Oh,
Um,
young,
yeah,
yeah,
all of
young
the
kids, right?
vaccines. Like I believe it's in the hundreds of this. It's like 150 to 200 vaccines within like the
Yeah,
first couple days of life, right? Which is
yeah,
just like
yeah.
absurd. It's so absurd. Um, Actually, my wife and I
Things are
going to have a
changing a
baby
little bit.
soon. Yeah, we're actually doing at home water birth. So we're working with a dual
Nice.
midwife. Yeah, and we're going to be at home through a water birth,
Beautiful.
right? And I think that's how we were
Mm.
intended to do it. You know?
And that's a look, a lot of it is also coming, if we're talking about childhood, just obesity you touched on, because, I've seen you see a lot of overweight kids and just being in the States and over here. And it all stems from what the mother is doing pre-birth. And I know, look, I do a lot of fertility and your wife is about to have a baby, but it's also what we're doing in that 3 to 6 months prior to conception, but what the mother is exposed to during pregnancy and in that gestational period that will, like you said, help whether the baby is going to be giving them the best start possible to better genetics, better health outcomes, right? If you can give them with a good set of genes, it's always going to be better for them than to, not look after your health and you get to have a child that's constantly sick or all sorts of things. Because, like I said, it has to do with the environment that they are in, right? If the kids are sick or they're having chronic inflammation, you just look at what the parents' health is like, what they're eating
Yeah.
together as a family, and you can usually see the
Yeah, and even with
correlations.
I know your line of work, you see this all the time, but like with the formula that they give these babies, right? Like my wife and I were just like we're doing the natural way. We were curious about what's in these formulas, and I was just reading off some of the labels on them, I'm like, this is crazy. Like the top ingredients are like seed oils and, homogenized dairy. It's like, this is absurd. And this is what they're living off of, right? It's no
Yes,
wonder we
yes.
have so much illness.
I know. Yeah, I mean, look, and now there's more allergies than ever before, like talking about even just inflammation. When we grew up, it was probably like maybe peanut allergy every now and again. Now, like my cousin was telling me the other day that at a daycare center, they literally have a rap sheet of allergies. There's no eggs and dairy and nuts and now salmon, and the rap list is getting longer and longer. You can't have like you can't have basically anything. And a lot of these kids have so much allergies, inflammation because their gut health is just they can't stomach things and they're having
Exactly.
all of these reactions
Well, yeah,
to
their liver's
food. And
inflamed,
it starts with
but then also like with the whole
yeah.
vaccine piece, right? Like, I believe peanut
Mm.
allergies come from peanut oil that was in a vaccine they were given, and their immune system didn't respond well to it. Same thing for egg allergies.
Mm.
Some vaccines have egg whites in them,
Yeah,
and
totally.
that traumatic experience with
Yes,
the
yeah.
vaccine triggers the egg white allergy. It's really interesting.
So it's tough, like, yeah, we start life already full of toxins before we've even,
Before
sort
we even
of,
had a
reached,
chance. I
1 year
know.
old. We've all had a chance. But sometimes it's like as soon as you're born, right, you get hit with a bunch of needles
Mhm.
straight away. Look, you mentioned alpha-gal
Yes.
syndrome. Can we talk a little bit about that? Because it's not a common thing, and especially someone that just gets a tick bite and has a severe
Mhm.
reaction. So how common is alpha-gal syndrome? And to the listeners who've never heard of it, you said it's from a
Yeah.
tick bite. What symptoms can sort of come about from that?
Yeah, that's a great question. So with alpha-gal syndrome, I mean, number one, it is severely underdiagnosed, and doctors don't even know they're looking for it. It's a relatively new condition. I think it's really only blown up in popularity over the past 10 years. Like, it's really become known over the past 10 years. Way more people have it than they know they do. It is triggered by a tick bite, which is also some research showing that I've come across people that claim they got it from a mosquito. So there's other vectors as well, but it's thought to come from a tick bite. And what happens is this tick introduces a sugar molecule into your system that came from the mammal they were just feeding on. And now your immune system sees that as a threat, right? And so the name alpha gal comes from the sugar molecule that your body reacts to. It's called galactose alpha 1 3 galactose. That's the sugar molecule. Your body latches onto that as a threat, and you go into an allergic reaction whenever you're exposed to red meat like, deer, pork, beef, lamb, and then also for some people, the byproducts as well. So like for me, I was one of the very severe cases where I was reacting to gelatin, I was reacting to dairy, even carrageenan,
Wow.
which is a red algae used in a lot of
Mm,
vegan products.
yeah.
It's not from a mammal, but the protein structure kind of mimics that alpha gal structure. So it becomes an allergen for people that have this condition. And yeah, another reason why it's underdiagnosed is because unlike other allergies, the reaction is delayed. So, most allergies, it's immediate. This isn't a
Yeah.
sensitivity. It is an IgE allergy, but you don't react till like 2 to 8 hours after you've had the exposure, which is crazy. And for a lot of people, there's two main variants to talk about. They talk about like a GI variant and then the more traditional variant, which is like anaphylaxis. But the most common symptoms are digestive issues. It could be diarrhea, like just inflammation where you have like histamine issues. You get migraines, a lot of cardiac symptoms, like maybe heart palpitations, high blood pressure. Those are all big signs of alpha gal syndrome. If you see all those things together and you can pinpoint maybe a meat exposure in there that's contributing to that, that's a good sign that you're dealing with alpha gal syndrome.
So, and how do they get tested? Is it
Mm,
just through their local doctors? Or you said, like, obviously not many people are
right,
sort of looking for that,
right.
right? So, where is the diagnosis and how did they come about with that
So the test you
diagnosis?
want to get is called an alpha galactose antibody test. LabCorp offers it. Really, you just need a practitioner that's willing to order it. It's a simple test to order. If you ask your practitioner, they should be more than likely to do it for you. I did just have a client speak with their practitioner, and for some reason, they just didn't want to order it. They were like, "No, I'm not ordering that," which is a shame. But it's very
Right.
simple to order through
Right.
LabCorp. and you want an alpha galactose antibody
Yeah.
test.
So if you know you've recently had a tick bite, or perhaps like something that was, you had a bit of a
Mhm.
bite and then you noticed, swelling in the area,
Mhm.
and some of the symptoms start appearing, then could be worth checking for.
Definitely.
And so, yeah, you mentioned that, you really look at the 4 pillars of health. So
Mm.
when clients come with any sort of mystery illness, they're not feeling great, what are the 4 pillars to help clients rebuild their health?
Yeah, no, exactly. So I look at health through what I call the 4 pillars, which is functional nutrition, therapeutic exercise, sleep and your circadian alignment, and then mindset and like nervous system balancing. Right. Those are I call them the 4 pillars because you have to get those 4 key areas right before you can really build upon that with detoxification and like additional mitochondria
Mm.
support.
Uh-huh.
Right. So like, let's say someone's rushing into
Uh.
a protocol to support the mitochondria, but their sleep schedule is terrible. They're not doing anything to exercise their body. It's like they're missing the biggest return on investment that they can do. Right. Right. So the key with the 4 pillars is to have a quick overview of each one. With functional nutrition, you need to get some foundational nutrient dense foods that also aren't going to activate your system, right? So there's the functional piece there, because if someone has something like alpha gal syndrome, red meat is very healing, right? But if you have an allergy to red meat, then that's going to cause you a ton of inflammation. So the functional nutrition piece, you have to come up with a diet that's going to be as nutrient dense as possible, but is going to be absent of those things that trigger inflammation for you, right, as an individual. Then with the exercise piece, we got to have movement, right? Like movement is life. If you could take all the benefits of exercise and make it into a drug, it'd be the top selling drug in the world. Right?
And so many people aren't
Yeah.
exercising. Like, I have to exercise like 6 days a week.
Mhm.
Like, I was at a dance class from 9 till 10 last night.
Nice.
And I make the time, but a lot of people say they're busy, they can't go
Right.
exercise, not even take a walk. And we live such a sedentary lifestyle. Everyone's always on the computers from literally 9 till, 6 PM, and then probably on their
Yep.
phones at night or watching Netflix or something like that. They don't find the time to exercise. And so their bodies become toxic. They don't sweat it out, right?
Exactly.
And movement is
It
key,
is key. And that's
right?
just the thing. As the world gets more toxic, the more important it is to have an exercise routine and just be moving, right? With our world the way it is now, you can't afford to not have a clean diet, and you can't afford to not exercise. It's just how it is, right? And that's when it goes into the other 2 pillars, which is, the sleep piece, circadian alignment, making sure you're doing what you can to get up, get some sun exposure first thing in the morning, right? Being mindful of all the screens that you're exposed to in the evening before bed, because that blue light can interfere with those hormones, right? Cortisol and melatonin. And then with the mindset and nervous system piece, number 1 is like, what is the story that you're telling yourself? Right? That's a big thing. I know you see this
Mm.
with like chronically ill patients. They have this story they're telling themselves that's not serving them, right? And it's keeping them in that sick state. Right. So looking at the story and also getting clear on like what your why is. Right. Because healing, it's a journey, it's a marathon, not a sprint. Right. And you have to be able to commit to that experience, and you have to have a strong why. So the why is a big piece.
We have a purpose, yeah.
Yeah.
What are you here to do? What's the purpose,
Yeah,
right? And a lot
exactly.
of the time, once you've lost purpose, you're no longer, wanting to contribute or whatever. People, that's why, the depression and I think suicide's a big, big
Yeah,
piece, because they've probably lost their why, along with because they're feeling so, so unwell. They
exactly.
just don't have any drive to continue,
Exactly. And then
right?
we need that
Yeah,
connection
yeah,
piece as well. And when you're chronically sick, it's hard to make,
yeah.
connections and be able to get out in public and have that community piece. And I believe that's a big piece
Yes.
for the depression as well.
We're social beings.
Yeah, definitely.
Yeah, well, we're social beings, right? We need to be out there and we need to have the energy to do that, right? If people are just can't even look after themselves, let alone think about socializing, right? So it's about building on all those pieces. Just quickly with the sleep, I've been working a lot with my clients on sleep as well, because so many people are not sleeping enough, or if they are sleeping, they're not getting deep sleep, right? So I've been getting people track their sleep. There's a smartwatch and get these rings and whatnot, right? And you can get these mats if you don't want either of those. But just sleep, and a lot of people are not getting, they may be in bed for 7 hours, but they're only getting between, less than 10% of deep sleep,
Yeah,
which is that restorative sleep and detoxification and when
right.
everything is happening.
If you're not sleeping, you're
So
not
I think the
repairing.
big piece is like, yeah, and a lot of people are not getting the deep quality sleep that they need. A lot of it is just core sleep, or they're restless, or they're waking up several times a night. Like, that's not normal
Yeah, I completely agree,
if you're
and
waking up.
it's yeah, how are you supposed to heal when you can't get into that reparative state, right? So that's really important,
Yeah.
and, I know some of the tools I like to use, like some magnesium, obviously, like magnesium bisonate to help calm down the
Yeah.
nervous system, right? Help get into
Yes.
deep sleep, avoiding,
Yeah.
high stress activities right before bed, trying to be off some of the screens. And then also something that I invested in that I've really been loving, and I started it after I was sick from mold, is, grounding bed sheets. Where and so basically you have these sheets that have a conductive material in them, like silver, and you plug it into the grounding port and like the outlet, right? And it connects. The idea is it connects your bed to the earth's frequency, so it helps ground your cells, helps to calm down your cells, and helps you get into a restorative state, right? Because no grounding has a ton of benefits. We were made for connection to the earth, and when you set your bed up with a grounding sheet, now you can sleep all night being grounded to the earth. And, I personally felt
Wow,
it.
I have to look into
Yeah,
this.
definitely. So, when I was real sensitive to
Wow.
everything, I would feel if it wasn't connected. My wife makes fun of me and likes to tell the story, but one night we went to go to bed, and she had washed the sheets that day and forgot to plug it in, right? She forgot to plug it back in. So, I'm laying there in bed, I'm, like, tossing and turning. I'm like, "What is going on?" It just felt different. And I got up, I looked, and it it was unplugged. And I was like, "Look." I was like, "Babe, you gotta plug it." But I plugged it in, it was good. So,
Oh, no, it's affecting my sleep.
yeah. But what's funny is that I could
Yeah.
actually feel it.
Nice. Well, no, I haven't heard of grounding sheets. That's
Oh, you gotta check it
amazing.
out,
Yeah, something to look into.
definitely.
Mm. For sure. For sure. So look, I guess sort of in wrapping up, when many listeners who are struggling with chronic symptoms, they feel really overwhelmed, hopeless, the doctors aren't helping. What message would you give someone who's tried, they believe everything and still don't have the
Yeah,
answers?
exactly. I mean, that's where I was. So I really feel for you if you're going through that. And I would say for one, your body wants to heal, right? It was created in the image of God with
Yeah.
his innate healing ability,
Design.
right? And
Yeah.
and you have to give the body what it
Yeah.
needs and remove what it doesn't. And if you're trying things and you haven't gotten better, or you've taken a test and they haven't given you answers, right? You're looking in the wrong area, or you haven't removed the right obstacles, right? And I would just encourage you that there's answers for those who seek, and to not give up on your health, right? Or accept that as your new way of life, because it's not how we're meant to live.
And I definitely think, look, if a conventional doctor's not working,
Mhm.
find a functional medicine doctor. They're much more
Exactly. A
better, or someone like
naturopath or
yourself,
someone that, yeah.
who is, yeah, someone who will look at natural medicine as
er,
opposed to just the conventional way, because, yeah, they're very limited and they just don't have the knowledge or the capacity to really be deep
Exactly. They
diving
weren't
with you
trained to
to
deal
find the
with
root
those type of
cause.
issues, right? They were trained for the
No.
acute, like treat this
No.
disease, right? Fix this wound, like with surgery. They weren't trained for
Yeah,
this type of holistic approach, which is what someone needs
that's
dealing with
right.
mystery illness.
And I think a lot more people are turning towards more holistic medicine. I've definitely seen an increase in that over the
Yeah.
years. And people are probably just fed up with the Western medical system, the conventional way of how they've been doing
Oh
things
yeah, I've
now.
seen the same thing. I'm excited
A
to
lot
see
more
the
people.
direction we move into, right?
Yeah,
It's becoming a lot more accessible.
totally.
Even like the foods, it's a lot more companies are shipping out things like the
Yeah,
grass-fed meats. Like we're moving in the right
yeah,
direction for sure.
yeah. We are. We are. But look, congratulations, you're about to become a father
Mhm.
soon. And look, how has your personal health journey now influenced the way you think about health, and especially for your little
Oh
one
my gosh,
now?
I know that's such a good question. I've been thinking about this a lot lately because it's no longer just about me now, right? This is going to affect generations. So my wife and I have been thinking about how can we set up our child for success, and like knowing what's healthy, what's not. Like I think of it like this: if my kid goes out for like a play date or something, and comes home and is like, "Dad, why is Timmy eating a Pop-Tart for breakfast?" Like that, that's not food, right? If they can say that, I'm like,
Mm.
I'm doing my job right.
Yeah. And look, I've got 2 kids of my own and we can only educate them once they're out there. Like my kids said today, look, Daddy, like Mummy, like there's going to be donuts at
Mm,
school because they're doing a big celebration. Can we have a donut? I'm like,
mm,
look, you can have a little bit.
mm.
It's also educating the kids that you're not depriving them, but it's like it's
Exactly.
a sometime thing, right?
Exactly.
They're going to want treats, but it's a treat. It's not like 80% of the time you're eating junk, right? If they're eating well 80-90% of the time, they can afford a little treat here
Exactly.
and there. I mean, look,
Teaching them
it's
that
life and
they
we
have
do
to have the
have to treat
foundation right,
ourselves. Yeah,
right? They can enjoy some things in
correct.
moderation. I think that's beautiful.
Exactly, exactly. But look, if there's one thing as we close off that you wished more people understood about gut health and chronic illness,
Mm,
what is a takeaway message for the listeners?
mm. I want to leave them with a good takeaway.
Or just a tip, a great tip that you think is a couple of things that would be valuable for those to sort of know about gut
Yeah, I mean,
health.
I would say to start just like the basics. Like look at your lifestyle, look at your diet. If those things weren't around, 100 years ago, then you shouldn't be putting it in your body, right? Because it's you can get very complicated diving into the topics of health, but when you really look at how the body functions, anything that matches up how we would have lived in nature is how we were meant to live, right? And I think that can really simplify things, even with the whole circadian rhythm piece, and of course the nutrition piece, right? If it wasn't around hundreds of years ago, then you probably shouldn't be putting it in your body.
Yep, don't eat less processed foods and more fresh, organic, natural
There you go.
foods.
There it is.
Perfect, Gabriel. Look, it has been awesome chatting to you, and we'll have to get you back on. We can talk about so many things, but I love what you're doing, and you're going to learn more about what Gabriel does. We'll post his links up there for you all. But thank you so much for joining us and for that conversation that, is very enlightening about a couple of things that you covered that most people probably haven't heard
Thank
about.
you, Ellie. I really appreciate that. I appreciate your time as well. And I love what you're doing to get the name out there, get the stuff out there about holistic health, help people heal. I think it's beautiful. So thank you very much.
That's all right. Awesome. Thank you so much for joining us
All
today.
right. Thank you. Bye.
What a fascinating and eye-opening conversation with Gabriel today. It's incredible to see how interconnected our bodies truly are, how gut health, environmental exposures, immune function, and inflammation can all play a role in the symptoms people experience every day. And for many people dealing with fatigue, digestive issues, anxiety, or chronic inflammation, the journey can feel incredibly frustrating, especially answers which are hard to find. But as Gabriel shared today, when we start looking deeper at the root causes, rather than just at symptoms, we often begin to uncover missing pieces of the puzzle. This approach is something I've been deeply passionate about as well, because whether you're talking about fertility, hormones, autoimmune conditions, or chronic mystery illnesses, the body has an incredible ability to heal when we remove the obstacles, seek answers, and support it properly. If this episode resonated with you, I encourage you to share it with someone who may be struggling with unexplained symptoms or searching for answers. If you enjoyed this conversation, please make sure you subscribe, leave a review, and share this episode, because it will help us reach more people who are looking for hope and solutions on their health and healing journey. Thank you so much for tuning in to the Holistic Health and Hormone Podcast. And until next time, remember, your body is always communicating with you. And when we listen deeply and address the root cause, true healing becomes possible. Thank you.